Hello, I'm Lisa Dixon, Editor-in-Chief of Psychiatric Services, and I feel so privileged to share with you today some information about a new process that we're introducing into the workings of the journal in terms of, again, how we address issues of racism. And we know, that the larger context is that there is a real need for psychiatric journals to examine and be present in addressing issues related to racism, both at the structural and individual levels. Our lapses around every step of the process have been documented, including at the level of content and focus, selection, and review. And we really need to do better. We've gotten started. We have increased, say, over the last year, the diversity of our editorial board. We've added several columns. We have proactively included more BIPOC reviewers, and we have formed work groups to address specific issues. However, these issues are so baked in, the issues of racism and how we think about it, that we really have to change the recipe, so to speak. If we are going to make sustainable changes, and I have no interest in making changes that are not sustainable, we need to update the way research is described and reported. So how to do that? Well, fortunately, we have access to expertise. One of our members of our editorial board, Roberto Luis Fernandez, is part of a group at the Group for the Advancement of Psychiatry that has developed something called the Gap Reach. So the Gap Reach is based on a checklist developed by the Gap Cultural Committee to evaluate published research papers. The overall goal of this Race, Equity, Culture Review, or REC review, is to enhance systematic reporting of data that can guide strategies to eliminate disparities and promote equity in health and healthcare. If we don't have the data, we can't make the fixes. Research examining mental health services, service inequities, and strategies for improving service delivery can benefit from a comprehensive, critical approach to collecting, analyzing, and reporting REC-related findings. We need to make ourselves accountable and be comprehensive and critical. Now, this review does not require the inclusion of race, equity, and culture-related factors when they are not pertinent to the research topic, nor does it seek to promote examining these factors in isolation from other social factors, such as gender or socioeconomic class. And we don't want to essentialize race, ethnicity. These characteristics intersect with a number of other social characteristics to influence a person's position in a social system and therefore pattern their experience. So we need to pay attention to race, ethnicity without isolating it from the other characteristics and essentially parts of a person's and drivers of a person's experience. So we have adapted the Gap Reach for use at the time of submission of articles. Questions are broken down into clusters to make it easier to consider every component of a research paper, including general use of terms, introduction, methods, sample, methods, data collection, methods, instrument translation and psychometrics, results, data analysis, and discussion. So each part of the research paper is going to be subjected to some inquiry. The responses to the questions, and these are short and brief, will be available to the editor and reviewers. The scores or the ratings of each of the questions will not be used to form the basis of reject, accept decisions. Okay, so it's not going to drive, better scores mean more likely to be accepted. That's not how we want to use it. This is a pilot that we expect to run for a few months. We want to see how it goes from the authors, for the reviewers, and for the editors. And we want to encourage authors and reviewers to provide feedback, and we will use the feedback for further development. So we really, really need you to tell us how effective or not this process is. So what are our goals? We do not want to simply promote inclusion of diverse populations in research studies, although it's not a bad thing, but we also want to promote the examination of how structural and cultural factors impact behavioral health service access, quality, organization, and funding. This includes the role of structural racism, socioeconomic status and poverty, migration status, language fluency, implicit and explicit provider bias, patient family cultural views of illness, and treatment that are different from those of mainstream services, but maybe not necessarily enough, and it's not enough just to include a diverse sample. We want to characterize the samples, we want to understand them as it's appropriate for the questions of each of our articles. Thanks very much, and we hope you find this to be enriching, and please give us your feedback.